Happy Monday. It is February 12th. You've got 2 days till Love Day. I'm your host, Kimberly Pro, and welcome to Wasatch Weekends. I certainly hope your team won that you were rooting for last night. I know it was an interesting one for sure. In today's episode, we have conversations around immunizations as well as blood cancer. What in the world is that? And I know that's a conversation we don't talk about often. Plus, if you are trying to figure out a last-minute gift for your loved one, Russ has a conversation with Etsy about some suggestions. Let's take a look at today's weather before we get started. Immunizations are very much an important part of taking care of your health for you and your family. We had a conversation with an expert around what to expect, how to plan, and decide which immunizations are best for you.
This time of year, it's very important for parents to stay on top of their children's immunizations. And right now we have joining us Dr. Michelle Fiscus to talk about the CDC's new program, or kind of program right now, to help get kids immunized. Thanks for joining us, Dr. Michelle.
No, thanks for having me.
How's it going today?
Doing well, thanks.
Good, good, good. Can you tell us what exactly this program is to get kids immunized right now?
Sure. So the Vaccines for Children program is a federally funded program that's actually been around since 1994 that makes sure that all children can get access to vaccinations that they need, whether or not their parents have the ability to pay for them. So children who are uninsured or underinsured, meaning maybe their insurance policy doesn't cover vaccines well, or those kids who qualify for Medicaid or are American Indian or Native Alaskan can qualify to get vaccines at no cost through the Vaccines for Children program.
That's amazing, amazing. The people that really need it, that's awesome. Why is it so important for this program and children to get immunized?
Well, it's critically important that all children have access to vaccines that are life-saving. And we want to make sure that they can do that without cost being a barrier. So often it's our Black and Brown communities that are disproportionately impacted by low-income families, or that have decreased ability to have access to healthcare. So making sure that they have access to those vaccines is really important, and they can get them through their child's healthcare provider or through their local health department.
Awesome, awesome. What's kind of the latest guidance right now around COVID-19 vaccines for children?
Really important question. So, a lot of us think, well, maybe we don't need to think about COVID anymore. Pandemic's over, kids maybe didn't get so sick. But it's important to understand that last year, COVID-19 was responsible for more pediatric deaths than any other infectious disease. That's more than flu, more than pneumonia, more than any other infection that children get. So it's really critically important that we're vaccinating kids against COVID. If your child has not had COVID vaccines since September, they are overdue for the newest vaccine to protect against the latest variants. So children 5 and up, they just need one shot. Contact their healthcare provider or your local health department to get that done. If they're between the ages of 6 months and 4 years, they might need 2 or 3 doses of COVID vaccine, depending on which manufacturer you get. So be sure to call your healthcare provider and find out what your children are due for and how you can get those vaccines most easily. And remember that they should be at no cost to you, whether they're covered by your commercial insurance plan or through the Vaccines for Children program.
That's awesome. And what do you kind of tell parents, Michelle, that are a little hesitant to kind of get their kids into this?
Yeah, I understand it. There has been so much information, especially on social media and just all over, especially since the pandemic. But as a mom, as a pediatrician, I can assure you that vaccines are the most important thing you can do to protect your child and keep them healthy. We all want what's best for them. And sometimes it feels better to do nothing, but really what we're doing is leaving them vulnerable to these diseases. So just like we wouldn't take them out without a car seat, we don't want to take them out into the community where they could get in trouble with some of these infections without having them vaccinated. So be sure to contact their doctor and find out what they need.
Right. And so obviously the Vaccines for Children program covers COVID-19 vaccines. What else kind of falls into that umbrella of vaccines that the children can get through this program?
Yeah, the Vaccines for Children program does cover COVID vaccines and flu vaccines and all of the other routinely recommended vaccines for kids. So whether it's measles, mumps, rubella, diphtheria, tetanus, polio, chickenpox, any of those vaccines that are recommended for your child are covered under the Vaccines for Children program or covered by your commercial insurance plan. So cost should never be a barrier to getting your children vaccinated and protected.
Amazing. And what's this vaccine co-administration? And can you kind of explain that and the benefits of that?
Yeah, vaccine co-administration simply means getting more than one shot at one time. Makes it easier on the child because they're not having to go back repeatedly and go through the process of getting shots. Makes it easier for the parent because they don't have to take off work or make multiple appointments to get their children vaccinated. And it helps everyone because it helps that child be protected against those diseases more quickly, keeping them up to date and helping to protect both them and the community.
Awesome. And where can people go for more information or to see if their child's eligible for the Vaccine for Children's program?
Well, you can go to cdc.gov and in their search there, just put in Vaccines for Children program or just vaccines if you want more information about vaccines in general. The easiest thing to do, though, is to probably call your child's pediatrician or healthcare provider or your local health department. Any of those places should help you understand what your child needs and whether they qualify for the Vaccines for Children program or whether you would use your commercial insurance to pay for those vaccines.
That's all such great information. Thanks so much for joining us this morning, Dr. Fiscus, and have a great rest of your day.
We have so many months dedicated to specific types of cancer, but what we don't talk about often is blood cancer, and it is very much a disease that affects lots of people. Let's take a look at the conversation to learn more about it.
Well, as I was talking earlier in the show, we like to go over some things in the community that pertain to health and wellness, particularly your physical health and your mental well-being. Well, today we're going to talk to two individuals with a disease called polycythemia vera, and that is a rare blood disease, and we're going to learn a little bit more about that. I've got Dr. Brandy Reeves. She's the Assistant Professor of Medicine at the University of North Carolina, Chapel Hill, the Division of Hematology. And we have Gary alongside her, who has been diagnosed with polycythemia vera. Good morning to both of you.
Good morning.
Now, Dr. Reeves, tell us a little bit more about PV, what it is, the symptoms, and how it's detected.
Sure. So polycythemia vera, or PV for short, is a chronic blood cancer that causes the bone marrow to produce too many blood cells. And those are especially red blood cells, but also white blood cells and platelets. And this leads to blood flowing in the blood vessels to be too thick, similar to a car engine with old motor oil, and that can lead to problems. So while some PV patients have no symptoms, most experience fatigue, itching, especially with a hot bath or shower, burning or tingling in the fingers or toes, concentration problems, feeling full after just a few bites of food. And PV can also increase the risk of stroke, heart attack, blood clots in the legs, lungs, or in the abdomen. And over time, PV can cause scarring in the bone marrow called myelofibrosis and can change into a really aggressive blood cancer called acute myeloid leukemia. PV is generally diagnosed by a combination of blood tests. So first with just a regular blood count showing that the blood cells are increased. And then with mutation testing, usually from the bloodstream itself, called a JAK2 mutation.
Now, Gary, with the symptoms that Dr. Reeves just reviewed, tell us a little bit about your diagnosis and how you became involved so much and found out that you had PV.
So As the doctor described, one of the symptoms is burning in the toes. That was my symptom. I've had it for a while, probably like 2010 to 2020. In 2020, it was coming when I wasn't hiking because I just assumed that it was when I was hiking. So in 2020, I went for blood test. It said I had a JAK2 mutation. I was misdiagnosed with ET, which is another form of MPN. And then in January, I found a specialist in Boston at Mass General. I had a bone biopsy and I was diagnosed with polycythemia vera at that point.
Now, that's one thing I wanted to point out, Gary. I was looking at some photos before the show, and you seem to be a very, very active individual. Tell me about how you've worked with your physician on your treatment plan.
Well, when I started, it was going to be when I heard that I had polycythemia vera, and I would have to have therapeutic phlebotomies. I was bothered by that, so I went out and did more hiking at that point in January of 2021. But the phlebotomy didn't work, so I tried that for about a year, and I was having a pint taken out about every 2 weeks, and I feel better when the blood was taken. But after a year, I had a conversation with my specialist, and she recommended that I try Bezremi. And in my experience with Bezremi, it's been very positive.
Now, Dr. Reeves, other than the Bezremi, is there any other treatments options available for people? And how do these treatment options affect someone that's as physical as Gary?
Yeah, so like Gary said, one of the treatment options is just therapeutic phlebotomy, where we're removing blood from the body. But then we also have medications like Bezremi, and there's also a pill called hydroxyurea. And both hydroxyurea and Bezremi are considered frontline treatments for PV patients who need more than just phlebotomy. And the big difference between those two drugs is that while both can reduce the blood cell counts, only Bezremi can reduce the number of PV cancer cells over time. And each patient is different in terms of which drug is best for them, depending on what they have going on in the background and what they like to do. But in general, both treatments are well tolerated and help polycythemia vera symptoms.
Nice. So, Gary, has it slowed you down at all, or are you still out there on the hiking trail?
It hasn't slowed me down. It's made me feel better. My toes aren't burning when I'm hiking. Hoping to get out to do another hike this weekend. We'll see. We'll see how the weather holds up.
Is there anything you'd like to tell anybody else out there that's been diagnosed with PV?
Do your research. Find a specialist. Go to the MPN Research Foundation website. Check out the Bezremi.com website. Do your research. Read up.
Nice. Dr. Reeves, any other place that people can go to find out more information?
Yeah, the other place would be the Leukemia Lymphoma Society, which is LLS.org. They have great, reputable information there.
Great. Well, I appreciate both your time this morning talking about PV, getting us a little more educated on what it is. And Gary, it's so happy to hear that you're out there still on the trail. Enjoy.
Thank you.
If you have been hit by Cupid and you don't know what to get your loved one, we had a conversation with Etsy about some suggestions for gifts for your friends and family.
Valentine's Day is right around the corner, and if you're stressing about finding that perfect gift for that special someone, don't fret. We have Etsy trend expert Dana Johnson joining us this morning. Dana, thanks for joining us.
Thanks so much for having me, Ross. Good morning.
Good morning. How's it going in your neck of the woods?
Oh, it's great. Just gearing up to celebrate love.
Oh, I love that. I love that. So as a trend expert, what are you seeing out there with this upcoming holiday?
Absolutely. So, we've just launched our Etsy gift mode that is here to make your life even easier for all your Valentine's Day needs. I'm loving the fact that on Etsy, in this gift mode, it kind of segments everything by persona. So for the globetrotter in your life, the person who loves to travel, I am loving personalized passport holders because it's really allowing you to then build memories every time you guys travel together. And then, of course, Valentine's Day is not just about romantic love, it's also about celebrating all the loves in your life. So for those gal pals for Galentine's Day, I'm loving personalized mugs that the two of you can have together as you sip your morning tea or your morning coffee. You think of your BFF. And then, of course, also don't forget the pets. They are, in fact, also a big love in your life. So why not think of a mommy and me or doggy daddy and me matching sweatshirts? I'm loving anything personalized that really puts that personal stamp on.
I love that. I love that. What about parents? Do you get gifts for your parents on Valentine's Day?
Absolutely. Valentine's Day is about celebrating all the loves in your life. For your parents, especially for those parents who love to cook, I love personalized recipe cutting boards. You can actually get their handwriting transferred onto the board, so it's cementing the memory of their recipe for forever and really has that special heirloom-like quality.
I love that. And what exactly is gift mode on Etsy? How does it work and how can people take advantage of it?
Yeah, so it's a new interactive hub. So basically, it starts with just asking you a few simple questions. So who you're gifting for, what their personal likes are, their hobbies, all of these things that kind of really drill down to all the things that they love. And then it's going to curate a list for you by persona, and it's going to show you all the different options that are tailored to all their likes for every budget need. And it's just gonna make no more guessing work. It is like the search tool that you need to make gifting easier than ever.
Yeah, and whether you're a man or a woman, you can find what you're looking for right there. So that's awesome.
Oh, for sure. I mean, right at the top, the first question is, who are you shopping for? So if it's husband, friend, kid, mom, coworker, the list goes on, and then we will do all the work behind the scenes on gift mode.
That's awesome. What else are you seeing out there in 2024 as some hot items and some good gifts this year?
Yeah, for sure. So one of the things that has been our color of the year that I was super excited to announce at the top of this year is berry. And this is coming off the heels of all of that bright pink that we saw last year. So now we're seeing richer jewel tones like berry that really create like this almost romantic essence. So you're seeing lots of sheer fabrics, lots of inspiration from ballet core, so wrap sweaters and deep reds and all of these things that kind of bring a sense of romanticizing your life into your home decor, into your wardrobe, and every portion of your life.
That's amazing. So kind of stepping it up from those classic flowers and chocolates for Valentine's Day. Check it out on Etsy. That's awesome. What's kind of next for you? What do you got going on next, and what's kind of the next trend?
Okay, so I especially want to call out the fact that on this gift mode, you're seeing things by persona. So it's kind of breaking down by your hobbies and likes. And one of the things that is popping up that I really, really love are these personalized recipe books. And this is for the cook in your life. So if you want to make sure that they are cementing those memories and even making memories with you by cooking in the kitchen and writing all these things down, really personalized is the way to go to make sure that you're cementing all those memories.
That's awesome. Dana, anything else I should have asked you? Anything else people should know either about gift mode or Etsy or Valentine's Day or anything else?
Well, I think the number one thing to think about, we recently did a study that surveyed Americans just about gifting, and we found that 50% of Americans who said, no, you don't have to get me anything, they were actually lying, and they secretly really wanted something for a gift. So I would say, don't ignore their personal likes, and a little something goes a long way. So even if someone says, nah, I don't want anything, try to get something a little special for any budget.
I love that. I love that. Dana, thanks so much for joining us this morning, and happy Valentine's Day to you early. And thanks so much for all those tips. That's awesome. Check out Etsy's gift mode for more.
Happy Monday. Thanks so much for joining me and starting your week here on Wasatch Weekends. I'm Kimberly Perot, and I'll see you next time.